joining us. This is Live with ChristiChristie. We have a YouTube channel where we seek to empower, encourage, uplift women. So if you're not familiar, check us out on YouTube. It's mainly we speak to women and families of women who have suffered infertility, any sort of child loss, infant loss, miscarriage, just pregnancy complications on their journey to motherhood. And so today we are going to talk about Black maternal health.
Yes.
And so just want to let y'all know we are not medical professionals. We're just speaking from our own experiences, things that you need to be on the lookout for, especially being a Black woman in America. It affects people of color at alarmingly higher rates than, other women, but particularly Black women in America. And so these are some things that we wanted to bring to your attention and just let you know to be your own best advocate.
Yes.
And so if
it's very important
to go, then we'll go ahead and get started. Christi, make sure you can still hear me okay?
Yep. Can you hear me?
Yes. Okay, perfect. Yes.
So I'm going to go ahead. Okay.
Y'all bear with us. This is the first time.
Well, I just want to talk about specifically with Black women, two things that I dealt with in my own health that affected my fertility journey, which the first one was uterine fibroids. And a lot of Black women, and actually I looked it up, Black women are 3 times more likely to develop uterine fibroids than white women, and are also more likely to develop the more harsher symptoms and not really even get them checked out. And so I wondered, like, why do Black women go through the pain and the, all the things that come with having, it's horrible, guys, horrible. So why do we put ourselves through those things? And why, and so in my research, I found that it's because we don't trust the medical system, because they don't listen to us. When I was first diagnosed with uterine fibroids, I was at Hampton, and I kept going to the emergency room. I had to have gone maybe 3 or 4 times in about the span of 3 and 4 months. And each time they misdiagnosed me. Oh, you have a bladder infection. Oh, you're probably just pregnant. How are you pregnant when you're not doing, like, don't you need sex for that?
Exactly.
So I'm like, how is that even, and I was constantly dismissed by doctors left and right. And I didn't at the time know what uterine fibroids was, because I was, 19? So I just kept going back. And then eventually I came back to DC and saw my primary care physician, who was a Black woman. And she said, have you ever heard of uterine fibroids? And by that time I looked like I was 7 months pregnant. And I'm like, no, I have no idea what that is. So it's very important. I wish I had known back then to fight for myself and to demand that they do more tests and to demand that they take my case more seriously, because I felt like all they saw was another Black college kid who was coming in complaining about some pain or complaining about something. And if I had known then what I know now, I definitely would have fought for myself, and I would have said, no, something is wrong and you need to do something now. Because while doctors are, yes, they go to school, they pass the medical board, all that good stuff, at the end of the day, you are the expert of your own body. You know what you're experiencing, you know what you're feeling, you know what is going on. So it is your responsibility to not look up on WebMD, but to advocate for yourself. Something doesn't feel right, and I need you guys to do whatever it takes to figure out what it is, because that's what my insurance is paying for, and that is what I'm trusting you to do for me. And the problem with the Black community is we have lost our trust in the medical field. And so we allow ailments and pains to progress in our bodies without seeking help, because we're like, oh, they'll just dismiss me, or, oh, they'll just throw medicine at me. So we've lost our trust. So we're like, why am I going to go to a doctor? Because to this day, I do not like going to the doctor and going to hospitals because of what I had to endure. So, I totally understand. And they said that's why a lot of Black women deal with this, because of the issues with the medical system, not being trusted, not being heard, not feeling like your voice matters. And so we want to encourage you guys today to know that your voice matters, your life matters. And if you don't have anyone else advocating for you, advocate for yourself. And if you're in a position where you can't, whether it's something's wrong with you, you can't speak or move, you need to train the people that are close to you, that your loved ones, fight for me. Do not let, this is what I'm going through, this is what I'm experiencing. Don't let them rest until they figure out what is wrong with me.
Exactly. And so, like Christy said, with fibroid tumors, a lot of times it affects the Black community in higher rates, and oftentimes it is genetic. So you will know, like if your mother had any sort of fibroid tumor, then it's likely that you may develop some sort of fibroid tumors. And some people don't even develop it until they are actually pregnant. And so, of course, that puts an extra strain on your body, because a fibroid tumor sucks, some of that blood away from you as well. Just like the baby needs your blood, the fibroid tumor will try
to take your blood.
Yes. So you have to ensure that the doctors are on you. If you know that you have a history of it, or it's in your family, that they need to be extra cautious looking for those things. In addition to that, pre-existing conditions, period, whether it's fibroid tumors, whether it's anything like sickle cell anemia, that has a higher rate in the Black community as well. And so women, when you are even considering getting pregnant, that's something that you have to consider. If you know that you have a pre-existing condition such as sickle cell anemia, lupus, any of those things, Crohn's disease, any of those things, you have to, know that it's going to somehow affect your baby if you don't get the proper treatment, proper prenatal care.
Exactly.
Such as with sickle cell anemia, people or women with sickle cell anemia normally have smaller children, while they are in the womb and everything. They usually tend to slow down the growth, and sometimes you end up with intrauterine growth restriction. And if it becomes severe enough, you will lose your baby. And so you have to make sure that the doctors are aware of that they are treating you for that, and they have that in their, in their notes, whatever, and that you really harp on it. Like, hey, this is something that I deal with. And so, how can you assist me in making sure that I have a successful pregnancy given this pre-existing condition? And so, like Chris said, you always have to be your own best advocate, even if you can't advocate for yourself. Make sure, like a lot of times in the hospital, they make you sign like a power of attorney or sign over, say that this person will be your healthcare surrogate in the event that something happens. And so you want to make sure that that person that is in place knows how to advocate for you as well. They know, okay, these are some things that the doctor needs to look out for, if I cannot advocate for myself for whatever the reason. And so just making sure that you all are on the same page.
Exactly. And like you were talking about pre-existing conditions, anemia and low iron and iron deficiency, they are also pre-existing conditions that can cause infertility and that can cause complications during pregnancy. And if you suspect that you may have low iron or anemia, you ask your doctor to test your blood, so that you can know all the information that you need to know before starting the journey to motherhood, or whatever have you, starting any health journey. You have to know what's going on in your body, what you need to work on. And you don't necessarily always have to take meds depending on how severe it is. There are holistic ways to increase your, blood count and your iron levels and all that stuff, certain foods you can eat, etc. But it is important because women of color, are more likely to have complications during pregnancy and to have issues with fertility because of the things that Christy and I discussed. And so it's very important, and no one knows why the numbers are so high with women of color, but Blacks and Hispanics are 20% more likely to suffer from iron deficiency and anemia and blood issues. And so it's important that you know your body, and that you know your health status and you get the help that you need so that you can be your healthy best self. It is very important. Talk to your doctor. Make your doctor your best friend if you have to. Talk to your
Exactly.
doctor and get what you need so that you can have a successful pregnancy and motherhood journey and even life journey. Because a lot of us
Yes.
go through life not knowing that there are things going on with us, and we start to feel sluggish and we start to feel sleepy all the time and lack of energy and lack of luster for life. And we're wondering, oh, am I depressed or is this and this? And sometimes it's just something in our body. It could be the iron deficiency. It could be the sickle cell. It could be lupus, whatever have you. And this is not to scare anybody. Do not go on WebMD and
Yes.
start looking up your symptoms.
Exactly.
This is just to say that, check everything, check every box. If you've tried different methods and it's not working, call your doctor and get
Yes.
the help that you need. It is important.
Exactly. It's so important. Some life and death important. And so, one of the other things Christy mentioned, blood disorders, and so like Black women of color have a higher rate of blood clotting disorders. And so that's something that can also affect you. A lot of times they have to run several tests to figure out exactly if you have a blood clotting disorder, unless you are aware of it, from your childhood, or
Exactly.
again, if it's genetic, then you may already know that you have some sort of blood clotting disorder. And so if that's the case, a lot of times, unfortunately, doctors don't test for some of these disorders until after you have already lost. You've already lost, multiple children, multiple miscarriages, whether
Exactly.
you have lost children, whatever, they don't take those tests until after something horrible happens. And so that's something that you want to be aware of, and maybe even ask them from the outset, hey, can you test me for these things?
Exactly.
See if your insurance will cover it, and see if you can go ahead and get those tests done prior to even starting your journey to motherhood.
Exactly.
Just so that you already have the knowledge in your head about what you may be facing, if anything, once you are on that journey to motherhood.
And never accept no. Don't accept no as the
No,
first
never,
answer at all.
never. No, no. And one thing that I've learned is, if the doctor, if you ask for something specifically, some sort of specific treatment, especially if you are already pregnant, and you ask for something specifically and they say no, tell them, can you put this in my chart that I asked for this specifically and that you said no?
Exactly.
Doctors, they don't want to open themselves up. They don't want to open the hospitals up to any sort of liability. And so a lot of times, if you tell them, put this in my chart, that you said no to this request, then a lot of times they will rethink, what they're telling you no to. And, just like Christy said, yourself. And so trust your intuition, your body. Of course, the doctors, they have that medical degree, they have that knowledge and everything, but you know yourself the best, your body the best. And so if something seems amiss about it, then you want to bring it to their attention and make sure that they take care of it immediately.
Exactly.
And not
Exactly.
allow for any sort of delay to go on and then something catastrophic happens.
Exactly. And that's the important part, because you don't want to lose your life or lose the life of your, child, because you're not being heard and you're not. And that actually makes me think about Serena Williams and what she went through,
Yes.
and how she knew that she possibly had a blood clot. And she told them, you need to do a CT scan. And they kept denying her.
Yes.
So it just shows you, it doesn't matter your socioeconomic status. It doesn't matter who you are.
Right.
They can dismiss you just as much as they can dismiss, someone who's not as rich and not as famous. So fight for yourself. Don't give up. Just like she didn't give up and she didn't allow herself to die in that hospital. Don't allow yourself to lose your life because someone isn't listening to you. If that doctor isn't listening, you're fired as my doctor. Go find me another doctor. You have the right to do that. You have the right to request another doctor. And don't let them push you into things that you are not comfortable with or you don't think will work for you, because that is another thing that can happen, with women of color and women in general, because they tend to try to scare you into some new drug or some new method, or saying, no, you don't need that because the risk, yada, yada, yada. You, like Christy said, you are your own expert. You know what you need. you know what works for your body. Fight for yourself and
Yeah.
fight for your rights.
Right, exactly. And just know what's in your medical report. Most hospitals, they give you access, where you can just go online and you can check what your chart says. And so know what's in there. Be familiar with your medical report, what they are writing in there. And if you have questions, ask. Do not be afraid to ask. They have to answer your questions. Of course, you can do your Google research, but it does not replace a medical degree.
Exactly.
Things
Exactly.
you may not truly understand just based on a Google search, and you won't have that knowledge. So just make sure that you are familiar with your medical report and that you are asking the doctor if there's anything that you do not understand, you need more clarification about, and even some of the medicines that they prescribe to you. Just make sure that you understand how they work or how they're supposed to work,
Exactly.
and that you trust them. If you don't feel comfortable with them, ask them, are there any alternatives
Yeah,
to
exactly.
this medication?
I've always done that.
Like
scrutinize.
Exactly.
Everything.
Yeah.
And make sure that what they're putting in your report is what they're actually treating you for. Because I've had some instances where it was on my medical record that I was prescribed a certain medication and that was never given to me. So and I had to call them and say, this needs to be taken off my record because I don't want something to happen to me and they think that I'm on this medication, so they withhold something that could be life-saving for me because it may counter affect the medication. So make sure everything lines up with what you know is true, because you don't want anything on your record that isn't about you, that isn't a diagnosis that you were never diagnosed with, whatever the case may be. Mistakes happen. Everybody is human, so just scrutinize your medical record. Education is very important. Be in the know.
Yes, exactly. And one more thing I wanted to mention in regards to things that affect us more is preeclampsia. Of course, this goes across the spectrum when it comes to women who are pregnant, but it typically hits us higher. And so if you have a headache that seems abnormal, ask about it, get it checked out, because you never know. It could be preeclampsia. I actually suffered from preeclampsia in one of my pregnancies that I lost, and it wasn't due to the preeclampsia, but just the fact that I had the preeclampsia, that's something that the doctors had to look for and continue to look for future pregnancies. So that's something that you want to note, because if your blood pressure goes too high, you can start to have seizures, and of course, if you seize too much, you can die, especially if you're not getting the proper medical attention at the time. And so just make sure, and families of women who are pregnant, if they are complaining about their head, don't say, "Oh, just go lay down." Make sure you probe and ask, like, "Hey, does this seem like it might be something a little bit serious, abnormal? Let's go to the doctor." Whatever. And it's better to be safe than sorry. Sorry, there's a train out here. I don't know if it's like extra loud, but it's always better to be safe than sorry. So even if you think it may be nothing, still get it checked out, because you don't want the worst case scenario to happen, and you could have done something to prevent it from happening.
It's better to be safe and sorry, people. It's better to be safe and sorry, unless your medical assurance only allows you a certain amount of visits a year or something. I don't know, but there's no many times, there's too many, that you can't go and see your doctor and get something checked out. And even if they try to dismiss you and be like, "What are you in for now?" Take everything seriously. Fight for yourself, and don't let people say, "Oh, you'll be fine. Go lay down," or go drink some water. Because water and a nap won't cure everything.
No, it will not.
At all. So it's just important to be in the know, educate yourself, advocate for yourself, and be the best healthy you that you can be.
Absolutely. So that's essentially what we wanted to let you all know. Of course, this will be on our timeline, so so you can replay if you missed any part of it, and we'll also post it to our YouTube page. Again, every Thursday we are posting videos on on YouTube. Rather, we are posting videos every single Thursday, usually 8 a.m. And so if there's anything else that you all want to hear from us, of course, let us know. Comments. We read those. Everything. And so, we really appreciate it. If y'all have any questions, thank you all for joining us. Lanisha, I see
Thanks
you
for
commented.
watching.
Yeah. The HBO special with Serena, yes, it's infuriating. Just
Mm-hmm.
the things that we have to do sometimes just to get heard when
Mm-hmm.
doctors, they should be there to assist us, and they're not. Of course, we're not talking about all doctors, all nurses,
Yeah.
medical
No.
but there
But
are
it's just
some out there
historically,
that,
there have
yeah,
been, medical field and Black community historically have not meshed well in
not
America.
gotten along.
So we're
Yes,
not going to go into the whole history, but y'all know, look it up.
yeah, exactly.
So there has been an ingrained distrust in our community where we've been kind of taught, figure it out, you fine, go drink some water or whatever, because if you go to the hospital to try to get this fixed, you may not come back the same, or
Right.
you may not come back at all.
Yeah.
So there's this built around distrust, and we're trying to rebuild the trust by, number one, advocating for yourself. So letting them know that you're serious and you know your rights and you are educated, and they're not going to tell you no. And if they do tell you no, then you're going to find someone else who you
Exactly. So yeah, definitely. Just be your own best advocate. And if for some reason you cannot, make sure that that person on your team, whether it's your spouse, your mom, your dad, whoever, that they also can be your best advocate in the event that you cannot at any point in time in your medical treatment.
Exactly.
So again, we thank you for joining us.
Thanks for watching.
And we will see y'all next week.
Next Thursday, 8 a.m.
Yes.
See you soon.
Be there. Bye.
Bye.